Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Brian Tuohy. He's an assistant professor of bioethics, and we're going to talk about the Kevin MD article, Left in the Dark, the censorship of health literature in prisons. Brian, welcome to the show.
Thank you so much. I'm really excited to be here with you.
So let's talk about this article in a little bit. First off, briefly share your story and journey.
Great. Yeah. So I think I probably have a bit of an atypical journey for someone giving someone here being interviewed. I'm a sociologist by training. So I finished my PhD in 2018, and I've been teaching at Temple Medical School for the last 3 years. So my research is interested in the social determinants of health and thinking about the relationship of communities, health systems, and yeah, excited to be here.
So, in terms of medical education, sociology is such an important part, as you mentioned, social determinants of health. For those who maybe not be familiar with that intersection, talk more about that. Talk more about that sociology, healthcare intersection, and why that impacts patients so much.
Yeah, I think, over the last 10 or 15 years, there's been a bit of an explosion within medicine of thinking about and understanding the role that social plays. So, it's really important to memorize all of the parts of a body and anatomy and to understand the forces in physics for heart rate and cardiology. But it's also equally as important to understand the role that legal status plays in experiences with health, the role that housing plays, the roles that food security plays. And so it's trying to improve the knowledge and understanding of context that our future physicians have when interacting with the patients in front of them to better understand who they are, what they're experiencing. If our mutual goal is to improve health, having an understanding of the context, having an understanding of social is something that is also as important as understanding some of these, key body processes that you learn about in med school.
All right, so let's talk about this Kevin MD article that you co-wrote with Hannah Calvelli and Olivia Duffield. It's titled Left in the Dark, the Censorship of Health Literature in Prisons. For those who didn't get a chance to read this article, tell us what it's about.
Okay. And first, I just want to give a shout out to my two co-authors, students, Hannah Calvelli and Olivia Duffield, who are currently just started their residency training. Hannah is a residency in general surgery at Penn, and Olivia is in internal medicine. And so this paper, it started from, we have a relationship with an organization called Prison Health News, which is the only national organization that responds to letters from people who are incarcerated around health-related concerns. And so I formed a partnership with this organization that, I teach a class at Temple Medical School called Community Engagement, and we have relationship with different community partners in which our med students interact with. And so Hannah and Olivia became leaders in this organization. And so one thing that Prison Health News does is respond to letters from people who are incarcerated. It also produces a newsletter that is sent out quarterly to different prisons throughout the United States. And so we recognized that some of these newsletters were being censored and banned at random prisons. And so the question was why it was the case that some letters were being banned. What was the reason? And looking into it, there's, sort of a surprising level of discretion that prison systems have for banning literature that they see as problematic. And so, we begin with a story about Juanetta Harris, who's on the Prison Health News Board, who's been in solitary confinement for a really long time, trying to understand what was wrong with her. And she didn't know if she was going crazy. It turned out she had menopause, but she didn't have the ability to, read health textbooks and things to try and understand what was going on in her life. So it's about thinking about what people in prison should have access to in terms of understanding their health and thinking about what role society should play, in terms of, there people are being punished, and is this an excessive level of punishment keeping them from information? So how do we make decisions about the information that they should and shouldn't have access to? And we're trying to raise questions about that essentially. So
Yeah, so you mentioned that this newsletter was being censored. So typically, what would be some of the content in this newsletter that would be so sensitive for these prisons to censor?
yeah, I think, an example would be like a diagram of doing like a prostate screening, like it would be seen as nudity. There is examples in the article diagrams that would be seen as something that it could be problematic in terms of like sexual gratification. And so just being banned, not from the content itself, but just from a very punitive angle in which the prison is and the different health systems or different carceral systems are viewing information. And so the goal really for us is just to raise awareness that
Hmm.
this is happening, that there's not really federal oversight for how information is decided upon in terms of like what can and can't get into the hands of people that are incarcerated. And so just trying to raise awareness of that is a key issue for us.
To your knowledge, is this happening in prisons across the country? Are there certainly select prisons that may have a more stringent standard of censorship? So, what's it like nationally?
Yeah, I think it kind of tracks with maybe with what you would expect in terms of the red state, blue state issue. But the key issue is that there isn't this federal oversight and that it is like one that varies significantly across place. And so some prisons are a bit more lenient, whereas some are extraordinarily restrictive. So the one that Quinetta is in that we report the vignette that opens the article in terms of how she's trying to understand menopause is in Texas, which is an extraordinarily restrictive state in terms of the things that people do and don't have access to. And so I think the key issue is that it varies significantly, that we're trying to raise awareness that this is even a thing and that's happening. And maybe I'm jumping ahead a little bit here, but just, I think it's important for the listeners of this podcast, we have, higher levels of social capital and just being aware that this is happening throughout the country and can hopefully lead to generating some pushback against it is sort of the key idea for us.
Now, have there been any studies that show the health outcomes of people in prison, the lack of health information, the lack of access of health information that they have? What kind of health outcomes can this have on the incarcerated population?
Yeah, I think the data is overwhelmingly shows that it is that prisons and carceral institutions lead to negative health outcomes. And even though it's the case that this is one of the only places that people are constitutionally guaranteed to receive health care, it's one that's done in an extraordinarily haphazard way. And I think that some listeners might be like, well, why does this matter to us? And I think that our key goal that we want to stress is prison health is a public health issue. Many people that are in prisons or that are affected by prisons will come out of prisons. And so I think that a lot of MDs that are working with folks, not just like at Temple when in North Philadelphia, which is highly impacted by mass incarceration, I think a lot of folks will interact with people who either themselves or family members have been involved with carceral institutions. And so it's important just to understand sort of the impacts that this can have on physical and mental health. But to answer your question, I think it's one in which we know that it leads to premature aging, chronic illness, long-lasting trauma, mental illness. And there's also the issue some prisons are privatized, in which the way in which they handle the health system is it's not necessarily about improving the health of populations within carceral institutions, but it's often about saving money. There's issues around, we know around copays in terms of, you might have to pay $5 to see a physician or a nurse when you're in a carceral institution, and $5 might not sound a lot, but if you're making 19 cents an hour, these things can be exorbitant. So I think the key aspect is that these institutions have negative health effects, both whenever people are within them and then later in terms of thinking about mental health issues. And I think we as a society have to think about like what our role is as a society in terms of like what how much punishment is necessary, um, and what is and isn't morally acceptable, I think is another key like ethical question that's associated with this. And so these are just some of the bigger issues we're trying to like get at by raising awareness around this stuff.
So, in general, what kind of health information does the prison population have access to? And I understand that it can vary, but just give us a general sense of what they have access to today.
I think that's a great question. And I think, a key aspect is, when we're thinking about health nowadays, I don't know what the age of the audience listening to this is, but a lot of us will go on to Google actually all this audience, you guys have all went to med school, but a lot of us, if we're looking at thinking about health related questions, we can go on the internet, and the internet is severely restricted within jails and prisons in the United States. So it's something in which most folks don't have access to. And when we're thinking about whether or not people have access to medical textbooks, it's one in which it varies significantly across place. So in terms of what people have access to, it's extraordinarily limited. It's
Mhm.
extraordinarily constrained. Oftentimes, either folks are waiting, a long time to get appointments. They have to pay these high copays to speak to a nurse, or they might have to, like, for those that contact and communicate with us in Prison Health News, it's literally, the mail of that this what do they call it, snail mail, the paper mail, like
Yeah.
where someone will, someone might ask a question about, like, I've been told that I have diabetes, and I'm just wondering if I can have a better understanding of what that is. They might not get a response for 4 or 5, 6, 7 weeks.
Wow.
Or if someone is thinking about, like, I have this condition and I'm trying to think about what I should and shouldn't eat. We have to take into account not only the constrained level of information, but also the constrained system in which people don't have access to any kind of food that, I think. So there's a lot of unique aspects of what health is like and how it's experienced. And I think the challenge is, and why I'm really excited that you published this article and a lot of folks are interacting with and reading it, is that, this is a hidden population in the
Mhm.
sense that, I think it's extraordinarily stigmatized. There's a lot of population feels like, if you're in prison, you might have done something to deserve to be there. But the question is, like, what should life be like when you're in prison, and what should we as a society find to be morally and ethically acceptable? And I think what we do now is not morally and ethically acceptable. I think the level of punishment is too high. The negative health implications are too high. And so again, it's just raising awareness.
Yeah. So tell me, in terms of other than raising awareness, let's say in your ideal world, what would you like to see happen? What would be your ideal scenario?
I think, okay, the ideal scenario, I think that there should be federal oversight for information that should be and shouldn't be allowed within prisons, that should be decided by folks like that are on this call or that are listening to this podcast, medical experts. It shouldn't be decided by random prison wardens who might not have the medical knowledge to know what is and isn't literature versus what is and isn't nudity and things like that. I think so. Federal oversight that says what people should and shouldn't have access to. I think increasing access to information shouldn't be so constrained. I think, people in prison are being punished by being in prison, and the level of punishment I don't think should extend to creating a situation in which people are ignorant about their existence and about their health and about their lives. I think it's a level that goes too far. So federal oversight, I think, would be a wonderful aspect if it was done by the one that was in consultation with medical experts. Um, I think, improving the conditions in general of people that are incarcerated would be like a first step. I think we have to, as a society, think about the cost benefit of prisons in terms of the incredibly negative implications they have on people's lives.
We're probably talking to Brian Tuohy. He's an assistant professor of bioethics. We're talking about the Kevin MD article, Left in the Dark, the censorship of health literature in prisons. Brian, as always, we'll end with some of your take home messages that you want to leave with the Kevin MD audience.
Great. So again, appreciate the opportunity to be on this call. And I think that, prison health is a public health issue that medical professionals should care about, regardless of whether or not they're involved directly in carceral settings, in the sense that people that are in prisons will get out of prisons, and people that are in prisons are socially connected to folks that are in communities and societies in which doctors are interacting with these folks. And it's an important area in which we should become more knowledgeable of. It doesn't, I would love for more of us to become advocates and try to make changes at the federal and state levels in terms of what people do and don't have access to. But what we could do at the bare minimum is just have a better understanding of what's happening in the world around us and what's happening within these prison systems. I think that generally the censorship of health literature is detrimental and unjust to patients who lack access to the means to information. And so we need to think about some of the bigger ethical questions around this and what people should and shouldn't have access to.
Brian, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.